in.
Hello, how are you this afternoon?
Good.
My name is Xenia Del Pozo. I'm going to be doing a head, eyes, ears, nose, and throat exam on you, okay? I'm going to start by washing my hands first. Okay, so I can tell by just looking at you that you have symmetrical facial landmarks such as your nasal labial folds and your palpebral fissures. I'm going to start by assessing and touching your head, okay? So palpating your scalp for any irregularities. Is there anything that's bothering you today or out of the norm for you?
No.
Okay, so I'm going to palpate your temporal arteries. I'm going to move down to your temporal mandibular joint. Can you open and close your mouth for me? Okay, one more time. Very good. So I'm going to ask you to clench your teeth for me. Okay, smile. Very good. Puff your cheeks out. Squeeze your eyes tightly shut. Very good. And now open them wide and wrinkle your forehead. Okay, great. So now I'm going to be assessing your eyes. First going to assess your extraocular eye movements. I'm going to ask you to look straight at me and you're going to follow my finger with your eyes, okay? Perfect. Now we're going to assess your visual fields. You're going to cover your left eye with your left hand, and then you're going to look straight at me. I'm going to ask you how many fingers you see. Okay?
2, 1, 2, 1.
Perfect. We're going to repeat the same process. You're going to cover your right eye with your right hand.
2, 1, 2, 1.
Beautiful. So now I'm going to assess your pupillary response. I'm going to dim the light in the room and use my pen light. Okay, you're going to look straight at me. The light's a little bright, but I'm going to be able to see your pupils a little bit more detail with this. Okay, your pupils are equal, round, and reactive to light and accommodation. Okay, so now I'm going to use my ophthalmoscope. I'm going to select my lens and with my index finger and adjust my light. Okay, I'm going to be about 3 to 5 centimeters away from you to be able to see your eyes in more detail. Okay, so I can see now by assessing your retina is pinkish in color. Your arterioles are bright red. Your veins are also large, and your optic disc is sharp and well defined. Your macula is also located temporal to the disc. Okay. Alright, so if you can, just tilt your head slightly back a little bit so that I can assess your nose. Okay, I can see your septum is a midline and your turbinates are also lateral to the wall. There's no edema or lesions noted or exudates. Okay, so I'm going to also put on gloves at this time to be able to assess your mouth. I'm going to start by assessing your lips. Now also checking your gums and your teeth. Okay, so now I'm going to use my tongue depressor to assess your mouth. You can open slightly for me, and I can see your oral mucosa is pink, moist. Can you say ah for me? Your uvula is midline. I don't know any lesions or exudates at this time. I also know that you have a Mallampati score of 1 because I can see your pillars, uvula, soft palate, and hard palate. Would you be able to stick out your tongue for me? Okay, and then lift it slightly so I can see the base as well. No lesions noted. It's pink and moist appearing as well. Now if you can push the inside of your cheek with your tongue on each side. Very good. Okay, and now I'm going to palpate your neck. I'm going to focus particularly on your thyroid at this time. Swallow for me. Okay, very good. I'm also assessing your neck nodes, pre-auricular, post-auricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. Very good. All right, so this concludes our exam, but I'm going to wash my hands. Have Have a great day. Thank you so much.